Welcome to Netsmart CareThreads, a podcast where human services and post-acute leaders across the healthcare continuum come together to discuss industry trends, challenges, and opportunities. Listen as we uncover real stories about how to innovate and improve the quality of care for the communities we serve. Let's get into the show.
Welcome, everyone. I'm Beth Reese, your host for today's episode. I proudly serve as the Vice President and General Manager for Geramed at Netsmart. And I'm thrilled to introduce our two distinguished guests, Todd Tyler, Chief Information Officer, and Mike Emery, Executive Vice President at Curana Health. Welcome.
Thanks for having us.
Thank you, Beth.
And Todd, do you want to tell us a little bit something about yourself?
Yeah, absolutely. So I've been in healthcare technology for the last 30 years, serving in various healthcare settings. Started on the acute side and also moved into the ambulatory behavioral health and spent a lot of time in serving the dialysis side of the business, and now focused on the senior living population. So happy to be here, Beth.
Thank you.
Michael Emery, very privileged to be the Executive Vice President of Senior Living for Curana Health. I have a background in 17 years of clinical experience as a first an ICU nurse and now a family nurse practitioner, although I don't practice that frequent now, but I still maintain my license. But just experience in this senior living post-acute space and very excited about the future and what we have in front of us.
Thank you. In today's episode, we'll take a deep dive into the strategies employed by Curana Health to enhance the health, happiness, and dignity of senior living residents. We'll explore the innovative solutions for senior care delivery with a distinct emphasis on prevention and care coordination. I can't think of better guests to shed light on the intersection of the exploding CCRC market, or continuing care retirement communities, and how Curana Health's medical practice group, Medicare Advantage Health Plan, and the Accountable Care Organization, or ACO, are partnering and teaming up with the senior living organizations. So together they're forging a path for improved outcomes for the CCRC residents. And we'll delve into how these partnerships are benefiting both the residents and the providers and contributing to positive outcomes. So without further ado, let's dive in.
Sounds great.
Sounds good.
And so let's start with the basics. So CCRCs, continuing care retirement communities, are more than just retirement communities. They're hubs of comprehensive care and vibrant living. And at their core, they offer a continuum of care allowing residents to stay in the same community while their needs might change over time. They have that sense of stability and familiarity and just a peace of mind knowing that they can stay in the same environment while meeting all of their needs. And for the first question I have for you both is, with CCRCs attracting more residents than ever, what factors do you believe are contributing to this increased interest in alternative senior living communities?
I think it's a great question. We're seeing those trends across the country. Curana Health has the opportunity to serve, members and patients in 28 states across the country. So we get a lot of insight for these communities, and we're seeing those trends because we believe, residents and members and patients have a lot of opportunity and choice, and they're very informed consumers as they continue to age the healthcare system. And so a lot of times they want to seek out the best fit with these ambulatory active seniors. And so they come in for the independent living, these CCRCs, and they start there. And they really just create a community of these seniors. And as they potentially, age and their comorbidities, have exacerbations, and they may have a hospitalization, they can go to the assisted living if they need a little more. So it's very attractive for them to be in this environment because it affords them opportunity to stay in that community at different levels of care as they age in place. And we're excited about partnering with them to help keep them aging in place for the longest amount of time in the lowest cost setting.
You can really see why they're becoming more popular than ever now because of that. And we'll discuss the factors contributing to the surge in interest and how CCRC providers are adapting to meet the needs of this diverse and growing market, which leads us to the second question. Can you discuss the growing middle market of individuals who don't qualify for Medicaid but can't afford the high-end CCRCs that we've often heard about? And how are providers adapting to serve this demographic?
That's another great question. Really, you see these, CCRCs, you have kind of two buckets. You have your not-for-profits and your for-profits. And I've seen both really trying to, capture that middle market as well. Because not everyone can afford the, either the buy-in price, that franchise, fee, however they brand it. But they really are targeting spreading that care across. And so that some of them have what they call supportive housing or affordable housing. And they make that part of their community, and they have either rent controlled or subsidized rent units. And, from perspective of Curana Health, we're payer agnostic. We want to take care of, senior living residents, 65 and older. So irregardless of who their payer is, their insurance, we have a product, whether it be our MSSP ACO, so that's a Medicare Shared Savings Program, so the MSSP, our ACO REACH, which is a high needs, and our sister company, Ally Align, which is a Medicare Advantage product. So we truly believe we have a product in value-based care in which our providers can serve these residents, regardless of payer. So the beautiful thing about a nurse practitioner or physician in our organization, there's no different way they treat in regards to the care that Curana provides these senior living residents based on their payer. It's just their needs and what they're uniquely bringing in, the input from not only the patient, but the patient's family, which we consider that family unit and the holistic care that we try to provide at Curana Health.
Curana Health, meets the resident wherever they are.
Yeah. Absolutely. I mean, I think you look at our models, and as we continue to evolve our senior living piece and the care model delivery, we're having what we like to brand, Curana Concierge Plus, and then we have our clinics. And it truly is meeting the needs where an independent living may constitute a brick and mortar clinic. We're actually investing and very excited, and I know we'll probably talk a little bit more about that, but some residents in assisted living or higher needs can't get out to those clinics. And so we actually have our providers go in-home to them to service their needs and keep them healthy, happy, and aging in place.
That's great. That's what I've heard in the market. The assisted living, right, spectrum of care is kind of widening as well. So the whole person wellness is a buzzword, right, in the CCRC world right now. And so we'll explore the amenities and programs that CCRCs offer to help residents maintain their health and vitality, from fitness centers to, education classes and on-site health clinics. So following that, the question is, introducing new care models and communities like CCRCs impacts the industry. How does this influence your long-term strategic planning at Curana Health? Yeah, I mean,
we're so excited about the opportunity that not only our care delivery model, but the value-based programs we have, CMS, Medicare, they're pushing everyone to value-based care. We've always had a vision that's where we're going to end up. We survive in what is called the fee-for-service world, very well, very knowledgeable about how to function there, and also well-suited for the future to be able to deliver value-based care. And we can't do it without our IT and technical partners here within the company to deliver, those aspects, because these residents and patients and family members, they're expecting a little bit more. And so we're very excited to deliver the care to them, but through in-person primary care, with also leveraging the capabilities of a telemedicine platform or IT infrastructure that we can service all their needs.
Yep, I think that's well said. And, from my perspective, coming into this setting, there's always a first things first, standardizing your platforms and getting, really your house in order so that you can provide not only the same experience, to your providers, but enable them with the data behind that to take action and provide that level and quality of care. And so with the partnership with GeriMed, we've done that in, a number of different ways. One is making sure we have a very enriched data set to drive population health. And with the real-time feeds we get on the data mart aspects, that's feeding our data warehouse that also further empowers our population health management tool set to allow that type of care to be provided. Secondarily, they have established a lot of great relationships with the other EHR providers in the space where we're establishing integrations so that our providers are not having to go chase information. They're getting all the information within those particular facilities so that they can spend more time focusing on providing care. And not only that, these other data sets they're providing other, opportunities to take, action and provide the, appropriate level of care for our patients.
One thing Todd said, it's very important. There's a huge appetite with our CCRC national partners across the country. With the model of care that we have tremendous opportunity to really work with them, but they're so excited about our ability with Netsmart and GeriMed to, interface, connect. That interoperability, you hear that a lot. That's kind of a buzz term. And I always say, well, what does that mean? I think with us having a platform with, Todd's vision and guidance, partnering with Netsmart and GeriMed, we have a tremendous opportunity to actually deliver on interoperability and not just say it. Because a lot of times people say, well, we're interoperable. They're not really delivering meaningful data that providers at the ground level can actually deliver better clinical outcomes. And that's such a key differentiator.
Yeah, I couldn't agree more. And the Care Fabric, offering that Netsmart and GeriMed have essentially enables us to get data from various other settings where patients may go, which enables us to put that in front of our clinicians so that they have all the relevant information at the point of care. And that's something we're going to continue to expand on, especially getting all that discrete data within there. Further also supports being able to drive the population health components that we're also offering.
Yeah, and I think, we take that next step further is like, as a healthcare provider, I'm a nurse practitioner by trade. I don't practice currently, but one of the things I heard at AMDA, American Medical Director Association conference many years ago was we operate in silos of excellence. Well, there's a barrier to those silos, and silos are necessary for HIPAA and, safety protocols, but we got to break those down. We have to have the whole aspect of care. So we need to be tied into the acute hospital and what happened during that hospitalization. What happened during their primary care visit that was outside of our primary care delivery? What happened at the cardiologist? How are those pieces, connecting so I can more efficiently care and better care for our residents and members, and making sure that I understand the whole picture and not just a piece of the picture. And that's really driving the tremendous outcomes that we'll talk about probably further. And very excited about that.
That is exciting. The providers don't care about value-based care. They care about taking, the best possible care of the patient, the resident, to make sure that they get the best outcome.
It's absolutely, you're absolutely right. Because a lot of times at the provider level, and we do a great job about, within our team having heavy education on what does it mean to be, provide value-based care, population health management. Providers at the core just want to provide great care. And they want to make sure they can do it efficiently, that they are not missing part of the picture, and that the information is at their fingertips and easy to access, because they love that engagement. These partnerships that we've been very strategic as an organization in choosing out, and why we chose Netsmart and GeriMed is because we want to put the best tools in the hands of our clinicians so they can deliver exceptional care at the bedside.
Which kind of brings us to innovation. So innovation is at the heart of CCRCs. And one of the company leading the charge is Netsmart. Our post-acute EHR, MyUnity, is the market leader in CCRCs. And as you mentioned, the Care Fabric, that's the interoperability and be able to not do individual integrations, but building an interoperability, an actual platform around the EHR is key to be able to scale. So in managing populations from a payer perspective, what innovative approaches has Curana taken to enhance the quality of care and managing costs?
No, I think it's great. We try to design it to be payer agnostic, but our sister company, Ally Align, their care model delivery is exceptional. The kind of outcomes and the amount of MLR they have percentage-wise is just best in class. So we've actually leveraged a lot of that and built it into how we deliver the care to every member and every resident, regardless of whether you're a Medicare Advantage in our MSSP ACO or ACO REACH. It's been tremendous in our ability to take that best in class standard, add a little Curana flavor and expertise, and then really deliver it to our CCRC partners across the country.
Yeah, the pieces that I would add on that, again, goes back to standardizing your entire enterprise on your technology stack. So between our medical group and the health plan, we've done that, and that enables us to take that next step further where, again, we're starting to enrich our data. Care Fabric is going to be a key piece of that, and we're going to continue to build upon that. And if we do that right, then we won't have to do these one-off integrations, across the board to get the data that we need to drive that particular program. So we're going to continue to stay focused on that and grow it from there.
Mike, speaking of the patient, so patient needs in CCRCs can vary widely, and we'll explore how CCRC providers adapt their services to accommodate both the low touch and the high touch care that is required, ensuring that every resident in the CCRC has their needs met. And given the diverse patient needs in the CCRC, how do providers adapt the services to accommodate this range?
Absolutely. So a lot of times historically in the CCRCs, you saw, well, a physician or nurse practitioner would just come by infrequently, not sure when they had, when they were around. And so the care was kind of fragmented. Or they held on to their community primary care, although it stressed the family because of transportation issues. So we really saw the opportunity to kind of flip that a little bit, bring the care on site. And not every patient is created equally. Within independent living or assisted living, or even some of these CCRCs have skilled nursing facilities or long-term care beds, where kind of quintessentially referred to as nursing home beds. And we've kind of adapted a lot of our historical knowledge and expertise between all the legacy companies which make up Curana, and applied that through heavy education to our teams, leveraging technologies to prompt our providers to look for conditions and say, hey, these 5 conditions were presented in a previous document, integration, why it's so important, analyze that and say, hey, have you evaluated that? Again, that doesn't tell our providers what to document. It gives them suggestions so they can start focusing on a particular area. And, independent living versus assisted living, independent living, a lot of times, very ambulatory, very active. They may be doing pickleball. So, we may need to sponsor some pickleball sessions here, we've talked about it.
I'm in.
Versus an assisted living, which may be more confined to their room and get out for less social engagement. So we've adapted through our clinic model, right, and making it very attractive for our independent and those highly mobile assisted living members in that community, but also applying the opportunity for not only our clinicians to go in home, but our care concierges to really engage that individual and provide that more holistic, walk through the building, talk to them in a private area, but really meet them at their needs. And another part that's been really great for us is doing our fireside chats. We invite not only the residents or members and prospective ones, but their families. Engage, what do you need? What do you need and what do you believe? And incorporating that potentially in our design model.
I like that.
Agree. I think I would add that, now that we have, rolled out a lot of our population health technology, having that inform the scheduling is going to be something key that we're going to focus on next, and making sure that we're guiding in and making sure that we're targeting where we need to focus first.
I love that. And preventative care, right? I know I do not like to go to the doctor, no offense. But if it's convenient and all they have to do is walk over to that clinic, that site, you're more likely to go actually see a doctor or an NP to get that preventative care so that it is more proactive.
Well, you're absolutely right. And I think we have to change, our philosophy and how we treat and being reactive and being proactive. Right. And it's also not just the visits. We set up blood pressure clinics. Hey, you want to pop in and get a blood pressure check just to make sure they're thinking about their health. That's not the only thing we want them to focus on. We want them to focus on that pickleball, that social engagement, that bridge class. But really also having our care concierge contact and reach out. Hey, is everything okay? We hope everything is. But just extending that olive branch to remain connected with them. And being on site and delivering it on site is a tremendous differentiator. I've talked to actually a couple of family members with large CCRC partners that are opening and launching brand new buildings and have Curana branded clinic. And the family members are like, this is the greatest thing. This just gives me so much peace of mind. Not that they didn't want to transport mom or dad to their appointments, but now they have a team that truly seems and is accountable for the care and provides opportunity to keep the family engaged in the care of their loved one. And so they can almost take a sigh of relief and trust that this amazing CCRC not only is great for them to live in, is a community, but they have the healthcare solution that is an expert in delivering primary care for these senior living residents.
And partnering with these senior living organizations, CCRCs, obviously leads to better outcomes, right? As we've talked about. So we'll explore then how these partnerships benefit residents and providers and result in positive outcomes.
Yeah, I mean, let Todd talk a little bit about the technology, innovations there. But from a perspective of the residents, we have data that shows that our outcomes are better than the benchmarks. And we are always, looking and analyzing that. And we can't do that without good data, right? And making sure that we have that data aggregated. And data for data's sake, you ask, as a clinician myself, a lot of times there's an adage that, why get an x-ray if you're not going to do anything with it? Same thing with data. It needs to be actionable data. And that's what our team is really keen on. And Todd leading the charge there with really building that foundation and then developing the systems that our operations team can really deliver on, and that ultimately our clinicians have the right information in front of them. It's like driving a car and saying, well, I don't know, your warranty expires in 3 days. That's not pertinent to you driving, right? You want to know how fast you're going, what the speed limit is, how much gas you have left. That's what you need. That's the data that you need. The other one's nice, but are you going to really pay attention to it when you're actually trying to get from point A to point B? And so that's what we try to approach the communities with and our providers, that they have the tools, that they aren't seeking out information. We bring the information to them so they can spend as much time, like here, right next to each other, delivering that care.
Agreed.
I love that analogy.
Yeah, I do too. And the importance of bringing everyone together that's, surrounding, the resident is absolutely paramount. And those are components that we're rolling out with My Health Point to, test that in the marketplace, where we're establishing the communication with the provider, the family, the patient, power of attorney, or what have you, to making sure that we understand everything that's going on from a care standpoint. And then, furthermore, where we look to advance that would be to making sure we're accounting for the residents' goals. It may not just be, everything that we're looking at from a quality of care standpoint. There's other important things that will help us drive it together, and making sure that we're really hitting the mark, on the care front, and also the personal aspect of our residents. So we're looking forward to that, and continuing the momentum and getting everyone engaged.
So Mike, you mentioned Curana Health's preference is on-site primary care, but how do you see telehealth impacting the CCRC market?
Oh, I think it's a great observation.
Modal of care.
Yeah, absolutely. And, we've leveraged extensively, especially during COVID in the early days and through the first year plus, telemedicine.
Right.
There's a lot of policy change or temporary ones. We do believe in on-site primary care as being preferable, but when you start talking about the complete package of what we're trying to service, not every community we can service initially with in-person. So we can be creative with telemedicine, obviously with the changing landscape with CMS regulations. But we're thinking the next level. We need a partner, to be able to give us the opportunity to leverage that, especially when we want to take the next step. Say we've started our Care Concierge, our Concierge Plus, or our Curana Clinic. Well, how do we incorporate and bring specialists on site virtually? We can do that because we have a captive audience there in the community. So it's not just about what we do now, it's what we're building for the future and how we complete the model of care that we're delivering at Curana Health. And I think it's a critical component to the future in the next 1 to 5 years.
100% agree. Meeting the patient at where they need the care at the immediate moment is absolutely the direction we're heading and need to take it.
For us, as kind of a best-in-class medical group, we had a lot of opportunity to pick out, be choosy who we wanted to partner with an electronic health record company like GeriMed. GeriMed is extremely attractive, not only because of the GeriMed product, right, being a best-in-class product, but the Netsmart family. You mentioned all the different lines, whether you're embedded with CCRCs or being best in class with telemedicine. That's where we saw and needed to be able to leverage Netsmart's, family of companies and that umbrella. And so it was really important for us to choose the right partner, and we're never look back. It's just been so exciting about the partnership and what we've created, and we still got a long ways to go, but man, I think we're really ahead of the curve.
Right. It's been really fun innovating together so far, and I'm looking forward to do a lot more together.
Absolutely.
100% agree.
So looking ahead, what does the future hold for CCRCs and partnerships and dedicated provider groups like Curana? We'll discuss how the work being done today lays that foundation for a bright future in senior living. So what do you see the future evolution of the CCRC market and partnership with dedicated groups like Curana?
Yeah, no, I think for us is always being innovative. We mentioned from fee-for-service to value-based care, and always looking at what's the future? Where's healthcare not going to be now, but in 5 years? And making sure we're well positioned to care for our residents there, and incorporating our CCRC partners. With our ACO, various ACO products, we mentioned an MSSP ACO or an ACO Reach, we have the opportunity to deliver better resources and programs, like we have a 3-day waiver, right? So thinking about how we can give better value to the community, to our partner, to create a longer lasting relationship. I believe you'll continue to see, a movement from as many years ago as you saw from the hospital to skilled nursing, long-term care, that, lower side of care, that lower cost center. It doesn't mean lower care center. It doesn't mean less care. It means how does Curana Health partner with Netsmart, GeriMed, and deliver that high level quality at a lower cost setting and keep them aging in place, because every time a resident goes back to a higher level of care, their morbidity and mortality goes up. And we really want to prevent that and have data to show that we can.
Well, thank you both for joining us. I've learned a ton about CCRCs. I love how Curana Health is partnering with the senior living communities, and you guys are cutting edge, and it's been so fun to talk with you and always to innovate together with you.
Well, thank you for having us. It was a pleasure being here, and we look forward to carrying things forward together with our partnership, as we both alluded to here today.
It's exciting.
I've enjoyed it. So anytime you need us to come back, we probably have a lot more material and love to have more discussion.
I know. Mine could go on for another 2 hours.
But no, I think it's great. Great conversations that need to be had. I can just imagine how much appetite is out there, and just for us to have these conversations and to even dive deeper into the technical capabilities and what Todd is really building as part of leading our technology portion of Curana Health. I think there's tremendous opportunity for us to deliver even more, and we're just getting started.
Thank you for listening to Netsmart CareThreads Podcast.
At Netsmart, we understand the challenges facing provider organizations. Our team will help you navigate changing value-based care models with solutions and services that make person-centered care a reality. We'll equip you with technology and services that provide holistic, real-time views of care histories that inform better decision-making and better outcomes. Visit us today at ntst.com. Netsmart, serving you so you can serve others. Thanks for listening to the Netsmart CareThreads podcast. Through collaboration and conversation, we can work together to make healthcare more connected than ever before and better support the communities we serve. To ensure you never miss an episode, please subscribe to the show in your favorite podcast player. If you use Apple Podcasts, we'd love for you to give us a quick rating for the show. Just tap the number of stars that you think the podcast deserves. Until next time.